Today's lesson, Acute Pulmonary Embolism Recognition and Initial Management. Acute pulmonary embolism is a potentially fatal condition caused by obstruction of the pulmonary arteries, most commonly from a thrombus that originated in the deep veins of the lower extremities. It is a high-yield board topic because rapid recognition directly impacts survival. Risk factors include recent surgery, prolonged immobility, active cancer, pregnancy, estrogen therapy, obesity, and prior venous thromboembolism. The pathophysiology involves clot migration to the pulmonary circulation, leading to impaired gas exchange, increased pulmonary vascular resistance, and possible right ventricular strain. Common symptoms include sudden onset dyspnea, pleuritic chest pain, tachypnea, tachycardia, and hypoxia. Some patients present with anxiety, hemoptysis, or syncope. Massive pulmonary embolism may cause hypotension and obstructive shock. Initial nursing priorities include rapid assessment of airway, breathing, and circulation, application of supplemental oxygen, continuous cardiac monitoring, and prompt notification of the provider. Diagnostic evaluation may include D-dimer testing, computed tomography pulmonary angiography, or ventilation perfusion scanning. Treatment typically involves anticoagulation with heparin. Hemodynamically unstable patients may require thrombolytic therapy. Board examinations frequently test identification of risk factors, recognizing sudden unexplained hypoxia, and prioritizing oxygenation and anticoagulation. Build confident clinical judgment through structured case-based learning, clear explanations, and board-focused practice at nurselearn.co. NurseLearn supports board readiness with realistic scenarios and accepts Afterpay for flexible access. Quiz time. Pulmonary embolism case-based challenge questions. Question number 1. A 58-year-old patient 2 days after hip replacement developed sudden shortness of breath and chest pain. Oxygen saturation is 88% on room air. What is the priority nursing action? A. Encourage use of incentive spirometer. B. Apply supplemental oxygen. C. Administer oral analgesic. D. Assist patient to ambulate. Correct answer B. Rationale. Sudden hypoxia after surgery suggests pulmonary embolism. The priority is to improve oxygenation immediately while further evaluation occurs. Question number 2. A patient with suspected pulmonary embolism is hypotensive and tachycardic. What complication is most concerning? A. Left-sided heart failure. B. Obstructive shock. C. Hypertensive crisis. D. Myocardial hypertrophy. Correct answer B. Rationale. A large embolus can obstruct pulmonary blood flow, impair right ventricular output, and cause obstructive shock, which is life-threatening. Question number 3. Which diagnostic study is most definitive for pulmonary embolism in a stable patient? A. Chest radiograph. B. Electrocardiogram. C. Computed tomography pulmonary angiography. D. Sputum culture. Correct answer C. Rationale. Computed tomography. Pulmonary angiography directly visualizes clots in the pulmonary arteries and is the preferred diagnostic test in stable patients. Question number 4. A patient with confirmed pulmonary embolism is started on heparin. What is the purpose of this therapy? A. Dissolve the existing clot immediately. B. Prevent further clot formation. C. Relieve chest pain. D. Increase blood pressure. Correct answer B. Rationale. Heparin prevents extension of the clot and formation of new clots. It does not rapidly dissolve the existing embolus. Question number 5. Which patient history finding increases risk for pulmonary embolism? A. Recent long-distance travel. B. Daily exercise. C. Low sodium diet. D. Seasonal allergies. Correct answer A. Rationale. Prolonged immobility, such as during long-distance travel, increases risk of deep vein thrombosis and subsequent pulmonary embolism. Strengthen board readiness with challenging case-based questions and detailed rationales at nurselearn.co. NurseLearn delivers clear explanations and accepts Afterpay to support your professional goals. Now let's move on to our case study, Sudden Deterioration on the Medical Unit. A 45-year-old woman hospitalized for pneumonia suddenly reports sharp chest pain and difficulty breathing. She appears anxious. Respiratory rate is 30 breaths per minute, heart rate is 120 beats per minute, blood pressure is 98/60 millimeters of mercury, and oxygen saturation is 86% on room air. She has been on bed rest for 3 days. Key correct action: apply high-flow supplemental oxygen, notify the provider immediately, and prepare for urgent diagnostic evaluation and anticoagulation therapy. Rationale: sudden hypoxia, tachycardia, hypotension, and pleuritic chest pain in a patient with immobility strongly suggest acute pulmonary embolism. Immediate oxygenation and rapid escalation of care are essential to prevent cardiovascular collapse. Advance your clinical confidence with realistic Saturday case day scenarios, board-focused lessons, and structured practice at nurselearn.co. NurseLearn enhances decision-making through case-based learning and offers Afterpay for accessible enrollment. I hope you enjoyed today's topic on pulmonary embolism. Please make sure to like, follow, and share NurseLearn. We need the growth and love helping nursing students become confident nurses.